Hello, everybody. I am Dr. Melissa Hague. I'm a practicing OBGYN. I deliver babies for a living and care for women through their lifespan. And this is...
Hi there, I'm Delane Vaughn. I'm a primary care family practice doctor, and I help women with diabetes reverse their type 2 diabetes.
Absolutely. So we are bringing this 5th video to you. So if you haven't seen the other ones, watch those, because this is kind of about the end game, where an OBGYN and an expert at reversing diabetes talk to you about what happens after you have that baby. We are physicians, but we may not be your physician. So this is not medical advice. These are just some things that we are recommending based on what we know from research and our own experience. But please talk to your own doctor before you implement any of these strategies.
Absolutely. And on that note, if you are medicated for your diabetes, you have been medicated because of the way you ate in the past. If you change to eating a different way, those meds are going to need to change. If you don't have a good conversation with your primary care provider who's giving you those meds to let them know that you're doing these dietary changes, you can get yourself into a real pickle and it can be very dangerous. So make sure your doctor knows, make sure you have a good line of communication, and make sure you get guidance for how to change those meds as you're changing the way you eat.
Absolutely.
All right, so we're going to share some slides here and dive into what life is like after you have a baby.
And I think this might be one of our most important talks, because I can't tell you how many women skip their postpartum visit. So I never really get a chance, like you.
I was training. I was that woman.
I never really get a chance to talk to them about, like, what's your long-term strategy? And if you plan on another baby, could you maybe avoid diabetes with that child?
Yes, yes. Yeah.
So breastfeeding, you do need more calories. So if you look at breastfeeding calories needed, you'll see a lot of different things, anywhere from 300 to 500 calories additionally per day over the non-breastfeeding state. I don't know if I believe any of that, but
the tragic thing about this is when I was breastfeeding, I thought that 300 to 500 was the perfect amount for a Snickers bar. I'm not kidding. That is not.
I don't even know how many calories it is anymore, but I know it's a lot of carbs.
Oh my goodness.
So really, I don't tell people to focus on the amount of calories they're eating. Just eat good foods. And we've talked about those foods throughout all these videos, but eat good foods to the point of being full, being satiated, and make sure, really above all, that you're getting plenty of water in, because you are making milk, which has a lot of water in it. So you've got to keep that water supply up. And Diet Coke doesn't count, okay? You gotta drink real water. So as we start talking about strategies to avoid recurrence of diabetes or to correct your diabetes after pregnancy, just keep in mind that if you are breastfeeding, you may have to be careful with some of these strategies. For instance, long periods of fasting can decrease your milk supply. I do have a few patients that do intermittent fasting during breastfeeding, and they have not experienced a decrease in their supply. But I would say the vast majority of women do experience a decrease in their milk supply if they go too long between eating windows. And we'll talk about that in a minute. But also, total wives' tale that bread increases your milk supply. That's ridiculous. You do not need processed foods to increase your milk supply. Beer also does not increase your milk supply.
Although it is very carby.
Very carby.
And guys, this makes a lot of sense. 10,000 years ago, there was not bread or processed foods or any of that thing. And we populated the earth and became the dominant species on the planet with whatever was available then.
And we continue to populate the earth despite all the odds being against us.
Yes.
And even as little as 100 years ago, we didn't have most of the processed foods we have today.
Absolutely.
And babies were still doing fine on their mother's milk.
Yes.
So really, those things, not important. But what is important is getting good nutrition, getting a variety of nutrition. We didn't really talk too much about supplements previously. The only supplement I would bring up for those women that are breastfeeding is vitamin D. I tell most patients, think about 4,000 international units daily. That's a lot more than what's typically recommended, but you should ask your doctor or your child's doctor about that recommendation, because that vitamin D recommendation is pretty new. It's in the last 2 to 3 years.
Wow.
Yep.
Would you say that you recommend that if you're going to make an attempt at fasting and it's not something you've established before, to have that breast milk established prior to doing that, making sure that you're making enough? And then if you want to start trying to implement a longer fasting regimen.
And I wouldn't start that until you're 3 months out.
Absolutely.
Like, get 3 months out from delivery before you start trying to play with that intermittent fasting window, for sure.
Absolutely. Okay. So the answer to your diabetes, and this is not only for gestational diabetes and not only for any, risk of diabetes in the postpartum stage, but the answer is going to always be to decrease your insulin resistance. You decrease insulin resistance by decreasing the amount of insulin you produce. It's always the answer.
Absolutely.
So let's talk about why fasting works, why fasting affects your insulin resistance. This graph here, this red and green graph, has your insulin level. So the amount of insulin in your blood versus the hours of a day. So it goes through a 24-hour day. And you can see the red part of this graph, the line is quite low. The insulin level is low, but you can see in the green area where people start eating. And this is representing a typical SAD diet, a standard American diet.
But you've already made your diet happy.
Right. Well,
during your pregnancy.
Yes. So this is going to be the representation of how most Americans eat. And really, we're just stimulating insulin production every time we eat, every time we take something in, kind of like you said in the last video. Every time you take something in, you're going to stimulate insulin production.
Right.
And that means that you can't reverse that insulin resistance. You have to have that insulin level quite low. You can see by 10, 11, 12, in the middle of the night, you can see that there is this insulin level still present. I love these graphs because the green versus the red point out how you always have insulin in your system. What I don't love about these graphs is that the insulin doesn't burn off that quickly. So when you eat breakfast at 7:30, by 8 o'clock in the morning or 9 o'clock in the morning, that number has not dropped that low. You haven't even digested all that food through your gut. So that has not dropped that low.
Well, especially if you ate a pastry and drank a glass of orange juice.
I was thinking of making McGriddle or make anything, a McBreakfast. Yeah. So, but yeah, you're going to have, once you do that first eating whatever meal it is, you're going to stimulate that insulin production, and it's really going to stay up most of the day until you stop eating, and then for a number of hours after you stop eating. So you can see that midnight or 11:30 meal at night, you can start to see as 1 a.m., you can start to see that start to taper off. You want to extend that period where it's down like that. And that's what this graph really represents. Again, you have an 8-hour eating window, insulin goes up, it stays up for a while. Again, it does not drop off from your meal at 10 p.m., 11 p.m., it's not dropped off. But I would say by 1 or 2 in the morning, it has dropped off. And if you push that eating off until 2 o'clock in the afternoon, that gives your cells 12 hours of not being exposed to insulin so that they can start to heal up from their insulin resistance.
And constantly driving that insulin down is what's going to prevent
that. Is what will fix it. Absolutely. So what do we do? What are the regimens? Really, it can be anything.
Lots of stuff.
Anything works. Yes. And really, I mean, if you really could get 8 full hours of sleep and have that as your fast, that would probably not be the end of the world. But I think probably most people find that they have to do 12 hours of fasting at least to start getting the effects that they want. Lots of women find that 16-hour fast with the 8-hour eating window is pretty sweet spot. Some women like to do a 6-hour eating window or even shorter, a 4-hour eating window. There's alternate day fasting, there's time restricted eating. There's all sorts of ways to do it.
Well, and when you're breastfeeding, I would say the big key is don't eat in the middle of the night. I mean, all of us have been up in the middle of the night breastfeeding a baby. Drink some water when you're doing that, but don't eat, because that can be part of your fasting window. Even if your fasting window is only that 8 hours you're sleeping, that is a great start. Absolutely. And then as your baby gets older and is needing less breast milk and eating more normal foods, or as you just have established breast milk supply and you don't have to worry about it as much, then you can start to extend that. That time. And then I just want to point out, time restricted eating, just every time you put food in your mouth, consider it a meal. So you wouldn't tell your children they need 8 meals a day. And you don't either. And I literally have told myself sometimes when I wanted to snack and I knew I wasn't hungry, I'm not a toddler. I don't need a snack. I can stop throwing a fit and drink a glass of water or have an herbal tea and I will be just fine. I really want to eat because I'm irritated about this thing at work, or I don't have enough time in the day to do what I think I need to do. It really has nothing to do with being hungry. And I would challenge you that most snacking is that.
Yes, there's not a biologic requirement for it. Absolutely not.
Absolutely not.
So there's many different regimens. Just start somewhere. I always recommend getting started that you start with how you've normally eaten, whatever that looks like. So if you usually have a breakfast at 8 a.m. and you're done eating dinner by 7 p.m., start there and then just start narrowing that window. Push off breakfast until 9, limit, stop eating dinner at 6 until you find what you like.
Or even clean up your in-betweens.
Oh, gosh, yeah.
If you find that through pregnancy, you had to have an extra snack after dinner to keep your fasting low, cut that out first.
Yes.
Or if you haven't been eating this way at all and you found us after your pregnancy, don't have breakfast, snack, lunch, snack. Start with, I just have meals. So I have breakfast and then I have lunch and then I
Yes.
have dinner and then go from there.
Absolutely. Absolutely. Make adjustments every 3 to 4 days based on how you're feeling and based on the results that you're looking for. If you're looking to normalize a fasting blood sugar, awesome. Wait till that normalizes out. Keep pushing
Right.
that narrowing of that window. Do understand if you're looking at a fasting blood sugar, it may take 7 to 14 days, so 1 to 2 weeks for you to see a fasting regimen start to show up as an improvement in that fasting sugar. So don't lose sleep about that.
And don't be in a hurry either. Sometimes when we make dramatic changes, they don't stick.
They're very hard to sustain.
Right.
Absolutely.
So do what works. And then when you've adapted to that and you feel like, okay, I'm ready to go to the next level,
Yes.
just make the next level half a step more than you think you can do.
Yeah.
I find I'm like, oh, I can do alternate day fasting. And I
can
can
eat once a week.
That's right. And I can now, but when I first started, that was a huge mountain to climb. And then I would get frustrated and then I would get down on myself.
And it's miserable and
then
I
it's a
can't
shame,
live like
right. It's a shame and a blame game instead of just, I'm a science experiment. And
Yes.
I am trying to find the optimal window where I feel the best and I'm getting the outcome I want, which for me, for the last 20 years has been weight loss.
Right.
And
Right.
now that I'm old, optimizing my metabolic numbers.
Yes, yes, absolutely. So that's how you get started. It doesn't need to be anything crazy. You don't need to listen and do any kind of crazy regimens. Really, start with where you are and start squeezing it in until you see the results that you like. So what's okay during a fast? Anything that does not trigger insulin release is okay. So recognize a fast is broken not by food, a fast is broken by insulin.
Right.
Okay, that's what will break your fasting. So coffee is fine. I always black like my soul. Black coffee is fine.
We're working on our soul.
It's probably fine with some creamer in it. So some fats, whether you use medium chain triglycerides, whether you use heavy whipping cream, coconut cream, butter. People put butter in coffee. That sounds insane to me, but I know people do it. Whatever
But
it
you
is.
don't mean like carnation.
No.
Vanilla, caramel,
caramel, hazelnut.
Yes.
No.
Make your own frappuccino at home.
Home. No. Even if it is sugar-free. Again, because remember, it's the insulin release. And a lot of those things are sweetened with artificial sweetener, and they will stimulate your pancreas to make insulin.
And again, I would challenge you, especially if you're breastfeeding, don't do the artificial sweeteners.
Yeah.
I think it's a bad idea. I'm not going to like throw a bunch of science at you, but just anything that isn't really great for you
is definitely worse for your baby.
Right. Not good for your baby.
So, coffee is fine. Fat in your coffee is fine. Tea is fine. Bone broth is fine. And even bone broth from like a box, it's not ideal. You're probably going to have to add fat to it to really make it meaningful. When you add fat to these things, that fat satiates you. It makes you feel full. So you're not like flying at the walls wanting to eat anything. It helps satiate you. So the fat is nice. If you're getting boxes of bone broth, it's really low quality, but it is salty. It is, liquid, and you can add fat to it. That's where I use medium chain triglyceride oil, is really to add fat to boxes of bone broth. Ideally, the bone broth you're going to get, you are either going to make it, you can go to your local like butcher and get bone broth bones from them. They actually put them aside. You can get those and you can look up a recipe online and you can make it, or you can go to your local health food store and they usually have them in the refrigerated area in their glass jars, and you can get bone broth that way.
And I don't think we talked about this yet, but one thing to consider is if this is new for you and you are starting time restricted eating or intermittent fasting, you probably need more salt than you think you do, especially if you're not eating the processed garbage, because it has a lot of sodium. So you might add, especially the bone broth is great because it should already be salty. I've also used pickle juice before.
Yeah,
it's a lot of salt and some good vinegar in there. And then the other thing that we haven't talked about this at all yet, Delane, is what happens when you go to intermittent fasting is your GI tract changes, and I find most women need to start taking magnesium.
Yes.
As far as absorption goes, magnesium citrate or magnesium glycinate tend to be the best, but really any magnesium product you will take every day is going to work for you. And I found when I started doing more fasting, I had to increase my magnesium for a period of time. And you will know when you need to decrease it.
Yes, you will. And you'll know because your gut you start having bowel
Churning.
movement changes.
Yes.
That's really what's going to guide that. If you're constipated, you need more mag. If you're not constipated, if you're the opposite of constipated, then you probably need to either back off the mag or add some fiber to your diet.
Yep.
So
here's the problem.
Yes.
If you have been following our recommendations during your gestational diabetes, that's phenomenal. You've already done a lot of the work, but even given that, just having gestational diabetes increases your risk of developing type 2 diabetes in your lifetime. Some studies say it's 50% risk. Others say it's closer to 75 or 80%. Again, it's really up to you though. This does not have to be your fate. I have so many patients who are like, well, everyone in my family has type 2 diabetes. Well, you don't have to be like everyone in your family.
Chances are good everyone in your family eats poorly.
Right. So how we eat and what we eat will impact our risk. And I would say you can reduce your risk probably back to baseline if you eat in such a way and time it in such a way that you reduce your insulin. If you're planning on another pregnancy after this one, nobody wants gestational diabetes twice.
No.
So doing everything you can between pregnancies to drive that insulin down is going to help prevent gestational diabetes in the next pregnancy. Now, there are some women that are going to get it no matter what. And we talked about that in one of the videos, how your insulin resistance just goes up in pregnancy. But if you can prevent that, or if you can be the person that, yes, you're diagnosed with it, but you're able to control it with diet alone, you still will reduce your risk of all of the outcomes we don't want.
Right, right. And recognize, again, I say that, we think it's genetic and my family, everybody has it. Well, yeah, everybody's eating poorly in your family. This is not a value judgment. This is just a biology issue.
Right. And you may have a biology.
Yes, that predisposes you to develop this quicker.
Just like alcoholism or some of those other things.
Absolutely. Absolutely. Yeah. But recognize, there's so much control agency that you have over this about what you're eating, cleaning up that part. And then if something does happen and you need some meds along the way, fine, we have that. But making sure that you're doing everything within your power will likely give you results that you never expected, including never having to deal with this and not converting into a type 2 diabetic in your later years.
And it's cheaper.
It's way cheaper.
Some of the newer drugs that really work well.
Nice.
Pricey.
And they don't ever go away. You got to be on them forever.
And I don't know about you, but my goal is to have the number of meds I'm on be less than my years and age.
Yeah.
So I'm going to start by trying to cut out these.
Absolutely. Absolutely. Well, we have some resources here for you. Multiple different resources. This is a shameless plug here, but I have a podcast. It's very good. I'm going on 200 episodes. Reversing Diabetes with DelaneMD. Check out my podcast.
And recently I loved your 3 episodes about your journey. The journey that you went on.
Yes.
I think it was really helpful to see it's not a straight line.
It isn't a straight line. And there's a lot of bumps and you make strides and then you live in that space and you still feel struggly and it just takes time.
I have not arrived.
And you know what? I haven't arrived. I don't know that I'll ever arrive. I think I've stopped looking to arrive.
I left, but I have not arrived.
Yes. Yeah. So that's a podcast that's available. There's the Low Carb MD podcast, which you've enjoyed quite a bit.
All those guys are great. They review a lot of research. They talk to a lot of patients that have had success. So it's just kind of a big mix.
Nice. And then Jason Fung does a lot of work with obesity, diabetes, cancer, PCOS. I didn't even
original intermittent faster.
Yeah, he is. He is the OG on it. So any of Jason Fung's books, the code books, so there's the obesity code, the diabetes code, the cancer code, and apparently the PCOS plan.
It's phenomenal. Yeah.
Metabolical is a great book by Robert Lustig. He's a pediatric endocrinologist. Really, really great book about our food sourcing and the diseases that it causes.
And if you're like us and you think, I have no time to read, listen.
It's okay.
We listen.
I'm like the only illiterate doctor you'll ever meet because I listen. Doesn't everybody measure books in hours?
That's right. How many hours could that be? You put on 1.5 speed, it's only 6 hours.
Yes. So all of these books I highly recommend on audiobook.
For sure. Except the PCOS plan, you can do it on audio, but the actual book has great recipes and meal plans and very concrete things that are kind of hard to get in an audio. But
nice. And then Fat on Amazon.
It's a phenomenal documentary just about how we got here. How did we as Americans get to the point that so many of us are overweight, obese, and diabetic?
Absolutely. I hope you found this helpful. Again, share it with people you love, people you know, share it with your providers. Let them know what you're doing and why you're doing it. Have them give you their feedback on this information.
If nothing else, we had a good time.
Absolutely, absolutely.
Take care.